December 2019. Hospitals in Wuhan begin seeing patients with an unfamiliar pneumonia. Within weeks, the virus crosses borders. Within months, the world closes. More than 7 million deaths are later reported to the World Health Organization, while the true toll may be higher. Schools shut. Businesses fail. Governments gain emergency powers. And one American scientist becomes the face of the response. Anthony Fauci stands beside President Donald Trump as fear spreads faster than certainty. China controls the earliest evidence. Washington controls the public message. And somewhere between them lies a question that still divides scientists, intelligence agencies, politicians, and millions of ordinary people. Did COVID begin through natural spillover or through a laboratory accident? Years later, the answer remains unresolved. But the struggle over that answer reveals something larger: how science, politics, money, and national power collided when the world could least afford confusion. At first, the story seems simple. A virus emerges in China. Public health officials race to understand it. But Wuhan is not just any city. It is home to the Wuhan Institute of Virology, a major center for coronavirus research. American funding reached some of that work, indirectly through EcoHealth Alliance, a New York nonprofit that held a federal grant and subcontracted research to Wuhan. NIH has said the viruses studied under that grant were genetically too distant from SARS-CoV-2 to have caused the pandemic. Congressional investigators later accused EcoHealth of violating grant terms and failing to report on time. Those are different claims, and they are often blurred together. Funding research in Wuhan is documented, proving that funded research created the pandemic is not. That gap becomes the center of the conflict. Because in the first weeks of 2020, almost nobody had enough evidence. Yet, the pressure to choose a story had already begun. On February 1st, 2020, Fauci joins a private conference call with leading scientists to discuss the virus's origin. Some participants initially raise concerns about features that appear unusual. Days later, several of those scientists begin drafting the paper later known as Proximal Origin. Published in March, it argues that SARS-CoV-2 is not a laboratory construct and presents natural emergence as the more plausible explanation. Critics later point to the rapid shift in private concern and ask whether political pressure shaped the conclusion. The authors say the evidence changed their minds. Fauci denies directing the paper or suppressing a laboratory hypothesis. The paper becomes one of the most influential documents of the pandemic, cited by officials and media as evidence against deliberate engineering. But it does not prove where the virus came from. It addresses what the genome appeared to show. The difference between those two questions would haunt the debate for years. Meanwhile, Trump faces a different problem. He is president during an election year, watching markets collapse and hospitals prepare for disaster. At White House briefings, Trump and Fauci become an uneasy pair. Trump speaks about reopening, travel restrictions, treatments, and confidence. Fauci speaks in probabilities, caveats, and changing evidence. Their differences become public. Supporters of Trump see Fauci as an unelected bureaucrat undermining the president. Fauci's supporters see him as a scientist resisting political pressure. Both images are incomplete. Trump repeatedly elevated Fauci by placing him before the cameras. Fauci also became a symbol larger than his formal authority. He did not close schools or issue state lockdown orders, but his words carried enormous influence. In a crisis, influence can matter as much as legal power. Every revision in guidance looked to some people like science adapting. To others, it looked like institutions changing the rules after demanding obedience. Then came masks, distancing, school closures, vaccine mandates, and an argument over what public health certainty should sound like. Early guidance on masks changed as officials learned more and tried to preserve supplies for medical workers. Later, universal masking became a central recommendation. Fauci defended the evolution as evidence changed. Critics heard contradiction. The same pattern followed the vaccines. The first trials showed strong protection against symptomatic disease, and vaccination sharply reduced severe illness and death. But protection against infection weakened as new variants emerged, and public messaging sometimes sounded more absolute than the evidence justified. Trump championed Operation Warp Speed and called vaccine development one of his administration's greatest achievements. Later, he faced resistance from parts of his own political base. Fauci became associated with mandates he did not personally impose. The pandemic turned technical questions into loyalty tests. Scientific uncertainty was no longer treated as uncertainty. It became evidence for whichever side people already trusted. The origin question never disappeared. American intelligence agencies split. Some leaned toward natural exposure. Others assessed a laboratory-related incident as more likely, often with low or moderate confidence. None produced public proof strong enough to end the argument. In 2025, the World Health Organization said the weight of available evidence still suggested zoonotic spillover, probably through animals. But it kept every major hypothesis open. The reason was simple. China had not provided all the early patient data, genetic sequences, market records, laboratory information, and biosafety details needed for a complete assessment. That absence does not prove a laboratory accident. It prevents one from being confidently excluded. China rejects accusations that its laboratory caused the pandemic and has criticized demands it considers politicized. But transparency is not a favor in a catastrophe that reshaped the planet. Without the missing evidence, every government can select the uncertainty that best serves its interests. Congress then turns the pandemic into an investigation of institutions. Fauci testifies in 2024 and denies funding research that caused COVID, lying about gain-of-function work, or orchestrating a campaign to suppress the lab leak theory. Republican investigators argue that officials dismissed legitimate questions too aggressively and that EcoHealth failed to comply with grant requirements. Democratic investigators answer that years of documents and interviews produced no evidence that Fauci caused the pandemic or secretly directed a cover-up. Both sides claim the record. The record itself is more complicated. It shows flawed oversight, private debates, political pressure, incomplete Chinese cooperation, and scientists making decisions under extraordinary uncertainty. It does not produce a single document that solves the origin question. The hearing room becomes a theater for a deeper national wound. Americans are not only asking what happened in Wuhan, they are asking whether the institutions demanding trust were honest about what they knew, what they feared, and what they did not know. History may never deliver the clean verdict each side wants. Natural spillover remains supported by substantial scientific evidence. A laboratory accident remains unresolved because crucial records are missing. Fauci may be remembered as a public servant navigating impossible conditions, or as the embodiment of an expert class that communicated certainty too confidently. Trump may be remembered for accelerating vaccines, for challenging China, and for undermining his own public health message. China may carry the deepest unanswered responsibility, not because a laboratory origin has been proven, but because evidence capable of clarifying the truth was never fully shared. The lesson is larger than any one man. During an emergency, governments ask the public to surrender normal life in exchange for protection. That bargain depends on trust. Trust does not require experts to be perfect. It requires them to distinguish fact from judgment, confidence from uncertainty, and public interest from institutional self-protection. COVID changed the world. The unanswered question is whether the institutions it exposed changed with it.